And sister, how are you? Today, God has given us another chance to discuss one of non-communicable disease which affect women, and it is not any other than what we call uterine fibroid. What is uterine fibroid? Uterine fibroid is an abnormal benign growth which normally attack the uterus. It may attack any layer of the uterus, be it endometrium, myometrium, or epimetrium. This growth can be either one or can be several. Now, how will one know whether she suffers from fibroid? One, the sign or symptoms of fibroid are: one, there will be pain in the lower abdomen of the affected woman. There may be abnormal bleeding from this woman. There may be bleeding after sexual intercourse. There may be pain during sexual intercourse. There may be mass in the abdomen. Somebody may think that she is pregnant because she is seeing the abdomen is extending, but what will make this person affected to rule it out is that she normally see her monthly period. This person may also develop anemia because of this bleeding. As we all know that blood contains our immunity and dictates our health status, if this person continues to bleed for long, she may develop other health conditions. Her immunity may be suppressed. Normally, this condition is associated with those who are obese, and so the obesity part may make somebody not know. What causes fibroid? What causes fibroid is not actually known, but it is follow family line. So we call it is genetically inherited. In very rare occasion do somebody develop it with no history of either mother, grandmother, or any other history of aunties having had fibroid. So one key thing which has been noted and confirmed is that it follows family. Other things which have been associated with the fibroid may be: one, eating of excess red meat; two, the hormonal balance in your body. If your hormone, you have excess progesterone and less estrogen which circulate in your system, that has also been associated with fibroid. So other causes may not be known. Now, how will one know that he has fibroid apart from the sign and symptoms? Anyway, what we can include in the sign and symptom is that the fibroid may also cause premature labor. In other words, a child can come out before the actual month because that growth suppress the baby to come out. A fibroid can cause termination of pregnancy, which we call miscarriage. Fibroid may precipitate infertility because with reduced anemia, just the way I've said, somebody may not have a normal hormonal flow to allow them have pregnancy. So there may be history of infertility for somebody with fibroid because the bleeding interferes. It can also interfere physically with the health of this person. So those are things in this I'm sorry, I almost forgot that fibroid can cause what we call rectal prolapse because that mass is pushing the rectum. Fibroid can also have what we call cervical prolapse. In other words, that mass which grew in the endometrium part may come out through the vagina, and it can be in the vagina. Depending on the size, it can protrude outside. You may just see a mass has come out through your vagina and you don't know which mass is it. That is called fibroid. So those may be other signs and symptoms among others which may be, for now, I have forgotten. How do we know as clinicians or medical profession whether this thing in the person is suffering from is actually fibroid? There are 3 to 4 approaches of diagnosing this condition, and one approach is that we palpate. When we find a growth in your uterus, one thing we may suspect is that there may be fibroid. So palpation is just to make us suspect, because there may be another growth in your uterus. So through palpation, a mass will be felt. One thing which should be clear is not that all clients with fibroid have a mass. Some, the mass is very small but causing a lot of trouble. It may be very small, not palpable, but it's causing bleeding and other conditions which I've said. But so palpation is one of the way of coming closer to the diagnosis. Two, there is what we call ultrasound. Ultrasound is another approach of diagnosing fibroid. And there is another diagnosis we call MRI. MRI is another scientific approach of diagnosing. Lastly, we may do biopsy, take a specimen, but this biopsy is just not to confirm the benign, but to rule out the malignant part of it. As you may know that malignancy is a life-threatening case, but benign is not very much life-threatening. It can cause death, yes, but if it is massive, but when it goes to malignancy, it may cause worry. So, how do we go about the management? One management which we should leave to the medical professional or the doctor who is seeing you to address. This pain will be managed, bleeding will be managed, and there may be a surgery to remove the fibroid. There may be other medical, what I call a conventional medicine, which can be given to shrink it, including hormones, which can be injected to suppress it. One thing which should be noted is that this is only experienced for those who are between the age of 40 and 49. In other words, those who are still within reproductive age. But once a woman reaches the age of 50 and has gone menopause, we expect this fibroid to shrink. In case it fails to shrink, we may be worried, because that means that it may be changing to malignancy. A few percentage of 2% of those who had what we call fibroid, which is benign, normally develop the cancerous part, which is called malignancy. How do we prevent fibroid? In case there is history of fibroid in your family, it is advisable not to wait until you are diagnosed with it. It is supposed to do the following. First, regular screening for fibroid. In case you may have those signs which I've said. In fact, you should not wait. It should be yearly screening for fibroid to rule it out. If there is history of hypertension, you are advised to go and rule it out. Screening first, then consult. 2, exercise. Do regular exercise and take plenty of water. When you sweat, you are regulating your hormonal flow, which control the fibroid. 3, your dietary check should be ensured. You increase vegetable intakes and you increase fruit intakes. One thing which I'll address next time is that vegetables are medicinal. Fruits are medicinal. They are boosting your immunity in a way or other and suppressing this fibroid. What we have not said, but still under investigation, is whether a fibroid has any relationship with the immunity. That one has not been addressed, so we are still in watch to confirm whether it is precipitated by that. Or it is advisable to reduce fatty diet intake, especially saturated fats. And since you will not be able to tell whether it is saturated or not saturated, allow yourself to take minimal intake of fats, minimal intakes of sugar, minimal intake of salt. Or there may be other factors related to that, But what I've discussed is what I feel are very pertinent for the public to know, at least to identify your role to play. Kindly identify your role in the control of non-communicable diseases so that we make our life be a bit sustainable. It will be my happiness if this video help you at least to control your family member issue. These videos will help you also control your own health, because we have several non-communicable diseases which maybe I will not have time to talk all of them. The happiness is that diet matters, exercise matters, and reduction of stress matters. Those are the three approaches. Your life behavior matters. Reduce alcohol, reduce intake of tobacco, and you will find that you are controlling several non-communicable diseases, of which some you won't know. And you may not appreciate it because you never saw it. And now you don't know whether what you did is what prevented it. Those who thank me are those who at least developed this condition. They followed my advice and then they recovered. They come and thank me for the article. Thank you. May God bless you as we get another chance. And I pray that we'll get another chance to discuss other pertinent health issues. Asante sana, Mungu akubariki. Tuonane next time. Asante sana.